Lately, it seems that many women are choosing to remove their breast implants. For some, it's an aesthetic preference, preferring a more natural appearance. For others, it's a health concern. And for many, it marks a powerful step in their personal growth journey. If you're considering implant removal, this video is for you. Today, we'll break down what you can expect in terms of changes to your breast shape and the options your plastic surgeon has to help you achieve the look you want. Hi, I'm Ramon Garza. I'm a board-certified plastic surgeon who specializes in complex breast reconstruction and aesthetic surgery of the breast and body. I make educational videos related to plastic surgery. If you like this sort of content, make sure to subscribe to our channel. The most common question I receive from patients wanting breast implant removal surgery is what exactly is going to happen to the breast shape? Well, everyone's case is going to be unique. So the outcome of your breast shape will depend on a couple of factors, including your skin's elasticity, the natural volume of your native breast tissue, how long you've had your implants, and whether or not the capsule will be removed. Generally though, a big thing I try to get across to patients is that your breast size will likely appear smaller than you think. Over time, the pressure of the implants stretches the breast tissue, causing it to thin, and without the implant, the chest wall can appear flatter and more hollow, especially in the upper part of your breast. The size and the amount of time you've had your implants will affect this. For many patients, an implant removal is a procedure they know they want to go forward with, even if the aesthetic outcome isn't as good as they thought it would be. To some, these negative effects can be discouraging to hear, and you'd probably question if the outcome is still worth it for you. But what if I told you the aesthetic outcome didn't have to be underwhelming? That after implant removal, you could avoid the hollowness, flatness, and sagging that many experience. As cosmetic breast surgeons, our goal is to make you feel confident in your body, not only when increasing breast size, but also when reducing it. That's where these next two procedures come into play. Starting off with fat grafting, which is a procedure where we transfer fat, usually from the abdomen or hip sites, to the areas of the breast that need more volume. This drastically helps to restore shape and fullness to the breast. This is a procedure that I do frequently, and I have found that it helps my patients achieve a fuller and more natural look. For some patients, a little more work is going to be needed, especially if they are removing a larger implant and their skin and soft tissues have stretched. This is where a breast lift, otherwise known as a mastopexy, can be very valuable. When a larger implant has been in for a while, the breast tissue becomes thinner and loses its elastic properties. And upon removal of the implant, the result is the breast is going to sag. With a breast lift, the underlying tissue is reshaped and lifted to enhance its projection and symmetry. Combining this with fat grafting allows you to achieve both fullness and a more youthful contour, ensuring that you feel confident with your natural shape. If you're interested in learning more about a breast lift and what recovery is like, check out this video here. Overall, it's a safe procedure with a high success rate and low complication rate. Now, this last procedure isn't a step that every surgeon does, but I believe it's essential for restoring your anatomy as closely as possible to its original state, and that is reattaching your pectoralis or chest muscle to the chest wall if you've had a subpectoral breast augmentation. For many patients, when their implants are placed, their pectoralis muscle is separated from the chest wall, so that the implant can be placed in this newly created pocket. In order to restore anatomy to its native form, the pectoralis muscle must be reattached to the chest wall. This maneuver may help with the mobility of your pectoralis muscle, though it's hard to measure. Personally, if it were my muscle, I'd want it reattached for optimal function, and that's why I take this approach for my patients. Removing your implants doesn't have to lead to bad aesthetic outcomes. With a good plastic surgeon, most breast mounds can look great, whether it's enhanced or natural. That concludes this video. Let me know in the comments if you have questions you'd like to be answered in a future video. If you like this content, make sure to hit like and subscribe to our channel. If you'd like to learn more about the procedures we perform or for more information regarding breast reconstruction, check out our other videos and look at our website at drgarzaplasticsurgery.com. Also, give us a follow on Instagram. We put lots of educational content as well as before and after photos. Thanks.